Good afternoon. It is 4 o'clock. Would like to call this November meeting of the McLean County Board's Health Committee meeting to order. So members Hanson, member Farley, and member Bangert are present. Get to my thing here. And this is where we read the thing, right? Mm-hmm. All right. Member Tompkins has indicated that he would like to attend remotely. Having conducted the opening roll call and declared a quorum as physically present, I'd like to inform the committee that Member Tompkins is requested to participate remotely under County Board Rule 2020 and in accordance with the Open Meeting Act. Notice was received from Member Tompkins in accordance with the rules. Per Board Member 2020, Member Tompkins will be authorized to attend the meeting electronically if a motion to approve the member's electronic attendance is made, seconded, and adopted by a majority of the members of the committee. May I have a motion to approve Member Tompkins' remote attendance? Motion by Farley, second by Member Hanson. Those in favor? Aye. Aye. Those opposed? And the motion passes. Jeff, can you hear us okay? Okay then. All right, well, we will proceed apace then and hope that Mr. Tompkins joined us. We'd like to welcome a couple special guests today. So first of all, we have membership from Chestnut Health Systems. So please take it away.
Just go right into it. Okay, perfect.
Yes, ma'am. Thank you.
Excellent. Can you hear me? I don't know. I've never used this before. Okay, cool. My name is Randy Derrig. I'm a community relations coordinator at Chestnut Health Systems. Please give me a little grace. I started this role yesterday. I was a prevention coordinator previously at Chestnut, so I know some ins and outs, but I only did our prevention community education, so this wider scope is new to me. So you guys are my guinea pigs a little bit. So I'm just going to give he told me about a 10-minute brief overview. As you probably know, we have a lot of services, so I try to condense it as well as I could, but if you're interested in learning more, I'd love to meet with you to go over those things. So Chestnut Health Systems, we had our beginning in 1973. Some of you might remember back to this. We had our original Victorian house on 206 East Chestnut. So we started there and we have expanded drastically since then. As you can see here, we have 11 locations in 3 different states. So we aren't just local to Bloomington Normal. This is our corporate office, but we have a large footprint in other areas. We have about 820 employees. And as you can see up there, a lot of other things happening. 13 service delivery sites. We are in those 3 states. We have staff across the country in 26 states. Something that's special to me is we've distributed 25,000 Narcan doses. That was something I did previously as well, was education of Narcan and distribution. So that's a really big win to help fight the opioid epidemic. And we treat 30,000 patients annually. We have a variety of different service lines. So we do substance use treatment, prevention and education, mental health treatment, primary care, housing, research, and then dental is our relatively new one that I'll go into a little bit more. I do want to point out that we do have a medical home model. So we like to have integrated care among all of our clients. So we like to look at the whole self and take into account if people are there for residential treatment for a substance use disorder, they might also have diabetes or be behind in their dental care, anything like that. So we want to make sure they're getting those other services they might need and not have access to. We do accept all insurances, and people with no insurance, we do a sliding scale fee down to $0 for care for a copay. So anybody is welcome at Chestnut. We do have, I'm gonna get this wrong, certified insurance register people. You guys probably know what I'm talking about. So we can get people registered for insurance right there for Medicaid. Our main campus that you might be familiar with is 1003 Martin Luther King Jr. Drive. This is our residential or inpatient care for substance use. We also do a variety of other services here. The main services are community mental health services. So we have a lot of things on here. I'll just call out the adolescent and adult mental health, mostly focused on adult. We do case management, psychiatric management, and then recovery supports. Hopefully you've seen McLean County Recovery Oriented System of Care, or ROSC. That is an organization out of Chestnut Health Systems promoting recovery. And then substance use services, which is what people mostly know us about. We have the entire levels that you see here up to detox. We do not currently have a detox at this location in Bloomington Normal. Carl Broman is our local detox provider, but we have everything up until that level. So we can do early intervention, outpatient, intensive outpatient, or those residential beds. We are also the drug court and recovery court provider. So individuals on probation can go through drug court to help their sentence and help keep them in recovery. And then we also do Medicaid-assisted treatment or recovery. These would be your buprenorphine, Suboxone, Vivitrol, really amazing medications that can help somebody stay in recovery and work through that journey. Our other location in town is our Chestnut Family Health Center. This is at 702 West Chestnut, and then 720 West Chestnut right next to it is actually our dental clinic. So this was renovated a couple years ago. It's a really nice facility, and we do have a community room there that you are able to use for free. So if any of you would like to take a tour of this, I would be happy to take you there or host anything there. We have about a 50-person meeting room that we can do. Our health center, a couple statistics here. We treat in 2024 about 3,800 patients. Most of them do have multiple chronic health conditions. About 86% were below the federal poverty line. So those individuals were on Medicaid, Medicare, or uninsured clients. About 26% of those had alcohol or substance use disorder, 40% tobacco users, almost 50% with depression or mood disorders. So that's, again, that kind of integrated care. We're not just looking at them for their vaccines. We want to make sure they're getting treated for all these other health conditions. We do have an in-house pharmacy that's really cool. So we filled 168 prescriptions a day. So people don't have to go out to a pharmacy, wait at Walgreens. And we've all probably sat in the drive-thru for hours at a Walgreens. So people can get their prescriptions right in-house. Our Chestnut Family Dental Center opened in spring of 2024. So again, if you'd like to take a tour, I'd love to bring you there to look at it. It's really cool. We have 10 dental operatories. In between spring 2024, spring 2025, we treated 972 unduplicated patients. So these would be individuals going to Medicaid providers in our community for dental care, which can take literally years to get into. And sometimes people don't want to go to those providers, whatever it may be. So we were able to treat a lot of people, peds through adults. So anybody is welcome here. We can do exams, cleanings, x-rays, and every patient does get an x-ray on their first visit, a panoramic. Fluoride, sealants, simple fillings, and simple extractions. So we don't do those crowns or restorative care, but if you are in so much pain, you definitely need an extraction, and that's hard to get in our community on a regular basis, I would say. Next, I have prevention. So this is, because I come from prevention, I just want to have a slide on this. So we have a lot of really good community education. Hopefully you've attended some of our trainings before. If not, I'd love to get you in to do a Narcan training or any of our other trainings that we do. We do have BN Parents, which is substance use prevention, kindergartners through college age and their parents. So we are at all the local schools and the colleges. So that's the program I used to run, near and dear to my heart. So I love that program. And through that, we have seen a reduction in 30-day use of alcohol rates by youth, increase in communication with parents, and then decreased perception of peer use of substances, which is really great to see. Over the past 10 years, we've seen a big change in our community of youth using substances has gone down significantly. So that's a really cool thing between BN Parents, Project Oz, and all of our other local providers. We also do ROSC, which I mentioned before, so the McLean County Recovery Oriented System of Care. And we're actually the statewide leadership center for ROSC. So all 55 ROSCs in the state, so 55 counties, get technical assistance from us at Chestnut Health Systems. So we're really well connected across the state. If you had clients or anything in other areas, we would most likely know a provider there that we could get you connected with. And then that overdose education, Narcan distribution. I just wanted to go over quickly Medicaid in McLean County. This is a really hot topic right now, as you can probably imagine. As I showed before, about 86% of our patients at our health center are Medicaid populations. And this is for the 61701 Bloomington zip code, specifically in 2024. And then the fiscal years are July 1st through June 30th. So we just ended that fiscal year, or 2 years ago, yeah. So as you can see, there's 11,000 individuals in the 61701 zip code that are Medicaid enrollees. So with cuts to Medicaid, this is dramatically affect those individuals as well as our clients at the health center and Chestnut main campus. So that's something that we're always looking at and advocating for, making Medicaid more robust and having people access it as much as they need. I also included the other Bloomington zip codes beyond that 61701, and that adds about 7,300 more people. So there is a large number of individuals in our community on these Medicaid services that might have trouble getting access, whatever it may be. So if you know any of these individuals, we'd love to have them have Chestnut Health Systems as their medical home, or we can refer them to other individuals that do accept Medicaid in our community. But as I said, we have that integrated model, so if they do have more complex, we're able to help them with that. That's all I have. Are there any questions? I know I ran through that really quick, but wanted to make sure I stuck to my 10 minutes.
No, of course. Thank you so much for coming in. Appreciate it. Any questions from members of the committee? Mr. Farley?
I read an interesting stat the other day, and I was wondering if you are experiencing it too. I read that 40 to 60% of unhoused are actually employed. They just can't afford to rent or buy a home. Or do you see that in our community with the unhoused that you deal with, that some of them are actually working, they just can't find a place to live?
Yes, with some of our clients, we do see that. And we do, our health center does have clients till 7 p.m. And we do see clients at that time, like that 5 to 7 p.m. that are working all day and then come in at that time. We do have unhoused without occupations as well, individuals, but we do see that. I don't know exact statistics or anything, but.
I was just curious.
Yeah.
Thanks.
I just want to say, and thank you for such a valuable community partnership that you have with McLean County government specifically. I originally come from the CASA world, and I cannot say how many cases I saw in which we utilized services from Chestnut, and I just know that there's such a strong partnership that we have, and I thank you for being here. Thank you for telling us about more of what you do besides what I just got to see and work with back in the day. But thank you, thank you, thank you.
Thank you.
No, absolutely. So yeah, just I was kind of wondering how you're going to do this because the scope of what Chestnut does is so broad, obviously. But lots of rabbit holes that we can climb down with all the things that are going on. But I did want to ask you, with these cuts to Medicaid, you mentioned that 86% of the clientele is on Medicaid. Our services
Or Medicare, sorry.
or Medicare, of
Yes,
course. Our
yes.
services are able to continue despite the funding interruption as best as we can, as far as you're aware?
The current funding interruption or the one that might be coming?
No, the current
The
funding
current,
interruption.
yes, we are able to, for currently, yes, we have enough in reserve since we are such a large organization that we're able to kind of take that hit for now. So I think it was back in 2008, 2012, when Illinois had some issues with funds. We were able to continue services at that time as well, since we are a larger organization and have those reserve funds or other programs we can kind of lean on at those times.
Excellent, excellent. Well, we're very glad that you're coming in, and let's continue to have those conversations so we can all partner and fill in these gaps where they come. One more question about Narcan. I know the health department is very active in distributing Narcan and trainings as well. Within Chestnut, is there a place that we can advertise where Narcan is able to be provided? So for those who've had the training, where can people find Narcan in addition to the health department? I
love that question. Thank you. We actually have opioid settlement funds from the county. I don't know if you all know that. So thank you for those. So I work with Amy Hopper at the health department to do that. We are currently working on a map that shows our Narcan vending machine locations throughout the county. So we have 9 placed right now. I know it's like the best kept secret, unfortunately. We're trying to get it out there. So there's a lot of really great locations, but the ones available right now, Health Department and Chestnut have those, and it is on 5 bus shelters that we're advertising those locations. So if you take the bus, maybe you've seen them before.
Of course.
So we have those, and then two to come soon. But if you go to chestnut.org/Narcan, it does also have all that information on there.
Excellent, excellent. Well, would love to share that out. Any other thoughts, questions, comments? All right, well, thank you
Awesome.
so much
Thank
for
you.
coming in.
Yeah.
We very much appreciate your time and look forward to continuing to partner with you. Thank you very much. Not on our agenda tonight, and last minute, thank you very much for your flexibility. We would also like to welcome Birth to Five. So we have Miss Amanda Breeden and Miss Becky Thacker as well. So please take it away.
Everybody good? Okay. Hi, thank you so much for letting Becky and I come here today. My name is Melissa Breeden. I'm the Region Council Manager for Birth to Five Illinois. How many folks in this room are familiar? Has anyone heard Birth to Five Illinois? Okay. So I'll give you like a quick overview so you're familiar with kind of what our focus is, and then we'll jump into the books I gave. So Birth to Five Illinois is funded by the Illinois State Board of Education, and we cover the same area as ROE, so McLean, Livingston, Logan, and DeWitt. What we do is we're that bridge between the new Department of Early Childhood that will open next year. We call that IDEC, IDEC, and between the families and providers. So Becky and I were out in the community, we're at various committee meetings, really identifying like what are the barriers that families and providers face for kids under the age of 8. And so we came up with something called the Regional Needs Assessment a few years ago. Our website info is on my business card, so please explore the reports section of our website. But the Regional Needs Assessment gives you like a nice bird's eye view of Region 17, what our strengths are, what are some areas we need to improve. And then the action and the family councils really are like the beauty of this work. So I'll let Becky describe her amazing family council, and then I'll talk about the action council after that.
Okay. Am I on? Oh, goody. I pushed it. Okay. My name is Becky Thacker. I am the Family and Community Engagement Specialist. So I kind of help with the Family Council. I'm kind of the facilitator for that, the point of contact. And those families are just as such. They are families raising their children under the age of 8, living within our region. So the beauty of that is they are experiencing everything that we are talking about. They are either utilizing those services, have utilized, or known somebody in their community that have. So they are giving those lived experiences to this work. So what we did was we asked them a series of questions, looked at a lot of data for our regional needs assessment, and asked them to tell us the story behind that data. And coming into the mental and behavioral health is, as such, just looking at like what services have you used? Have you used any of these services? Or if you have or haven't, have you had any chance looking at them? So that's the beauty of working community-wide, is getting to know these families, getting to see their perspective and how they can help move this work forward for us.
Yes, so Birth to Five Illinois, we want the families at the center. Their voice, their experiences drive what we do. And so we bring that to the Action Council. We review the data like Becky mentioned, and together those councils decide on what should our focus be. So we write recommendations. Together we work on SMART goals, but we really are a collective impact model. So Melissa Breeden is not going to fix anything in the early childhood sector, but our community and the dedicated people we have in it, we do have that ability to think outside the box and to use our own networks to really move the needle overall to create access to childcare, access to transportation, because we know for the workforce in general, people need housing, they need access to childcare and transportation for them to be a consistent, strong worker in our community. So that was a long-winded description I will pause there just to see if folks have questions on Birth to 5 Illinois in general.
I have a question. Becky, within the family council that you mentioned that you work with families and you review data. Can you cover a little bit about what kind of data you review with these families?
Sure. So we looked a lot at services that the families use, childcare being one of them, Preschool for All programs. So those are your state-funded, typically in a public elementary school, not always. And where are the slots at for that? Slots meaning like the how many children can they serve within those programs versus how many children under that age or in that age range 3 to 5 live in that community. And most of the time it's resounding that there's just not enough.
Right.
Not
they fill
enough
up very
childcare.
quickly, don't they?
Exactly. And so these parents tell you the story as to why. And a lot of it too, it may be just parental choice. That was just not a choice for their family. Perhaps they just felt that they needed to have their child in a full day program, whereas most Preschool for All programs are half day. And then there's other families that are like, I love my Preschool for All program, but then I have to transport my child to another program, and therein that lies the conflict of my work schedule just does not allow that. So the parents really tell us, where are those gaps? Where is the lived experience for that? Like, how is it really going to affect if we add additional spots? It's going to affect a lot of families. In a plus is going to give them an opportunity maybe to have a part-time job or to have some respite from their children if they're stay-at-home parents. So a lot of that is that honest, this is how it affects my family. And the truth of that is there are pluses and minuses for it all.
Sure. Okay. So if you got to wave a magic wand and solve the biggest problem that is facing parents of young children in our community, would it be more access to education, access to daycare? What would you feel like is one of the biggest factors that is impeding?
I love that question. I think Becky made a good point about what works for one family doesn't work for others. But I would say every family deserves some sort of quality support for their family that is affordable. Whether that's an aunt or uncle maybe helping to step in and provide like part-time care, or like a full-time childcare center or in-home. But I do think families need options that are affordable. I love my son, but if I all of a sudden had to pivot, quit my job and just be a full-time mom at home, like many women during the pandemic, I would lose my mind. I love him, but I'm somebody that really enjoys both. I love work and I love family. So if you don't have that other option, then you're isolated. And then we know that isolation leads to all kinds of other issues.
For sure. Okay. Well, thank you very much for that clarification. Did you have anything else to add?
I did really quickly.
Excellent. Yeah, for sure.
I know I gave you guys a lot to read, so I'm not going to read to you, but I did want to point out. So this is our Region 17 Mental and Behavioral Health Addendum. This is the bulk of what we'll focus on this year with our councils. If you look at page 11 briefly, that gives you just a great synopsis of like what's great about McLean County, what we're rocking at, what some of those needs are. And then as you move down, we're moving into the recommendations. So by the end of this year, which will be here before you know it, our councils will decide what are those top 3 recommendations. And so just to give you an idea, one of them for sure is increased training for early childhood education and care providers, parents, and caregivers on social emotional development, trauma-informed care, gender-affirming practices, and mental health first aid. So that's one that we decided we want to focus on, and we're already learning, which people and agencies in the community are rocking at that right now that maybe we can support and raise awareness for. Another one that I wanted to bring up, especially after Randy presented, was some of our councils recommended that we should have tax incentives to those providers that take Medicaid. So that's something to just point out. Another one is more play-based and art therapy available. As we know, kids learn as they go. They learn in the moment. They're very texture savvy, and we need more of that. And some of the workforce is also younger, which also learns as they go and learns hands-on. So if we can get some of those opportunities, that would strengthen both the child and the caregiver. And then lastly, I also wanted to just touch base. Randy and I just discussed this afternoon, just how important it is for all new parents to have a postpartum screening. It's not just something that the mom struggles with, making sure to do a temperature check on the family. How are we doing? Having a new child can bring a lot of changes, but making sure that that is available to everyone in the family. So I just want to encourage, before you go to bed tonight, you can read this. I'll quiz you tomorrow. But if you see some connecting points with what you all focus on for strategic planning, please be sure to reach out. I'd love to hear from you and just see where we can collaborate. We also brought chapstick because it's that time of year and some notepads in case you don't have enough. But that's all I have. If anyone has any final questions, happy to take those.
Any other questions from members of the committee? Well, thank you so much for all of that information. You've given us a wealth of things to look forward to, and we look forward to very much collaborating. I love to hear the focus on play-based learning and play-based therapy. That is certainly something that I see a lot of success with in my day job as well, and as well as the focus on and the need for mental health and newer therapies and newer things moving forward. So looking forward to partnering with you and supporting you on that. Thank you again very much to both Chestnut and to Birth to Five for coming in. Don't be strangers. Come on by anytime.
Thank you, guys.
Moving on to the consent agenda, we are going to approve minutes from October 7th meeting and recommendation of approvals of bills and transfers in the amount of $716,501.67. May I have a motion? Motion by Farley, second by Hanson. Those in favor?
Aye.
Opposed? Thank you, Member Tompkins. Motion passes. Moving on to item number 5, Jessica McKnight from the Health Department. We have no items for action. Director McKnight, anything to add about your report?
Just highlighting my report is the mobile health units operations for 2025. So a lot of good things happening with that. And I also did want to just touch base on our WIC program. And in Illinois, the WIC program is still, despite the federal government shutdown, operational through November. So I just want to get another plug for that.
Excellent, thank you. And we know WIC is certainly filling a lot of needed gaps in the last couple days as things are changing significantly. So very glad that WIC is still there. Any questions, comments for Director McKnight? All right, thank you so much for that. Moving on to item 5B, Mr. Wiley from the nursing home. We have one item for action today, request approval of the nursing home private pay rate for 2026. And may I have a motion? Motion by Hanson, second by Farley. Director Wiley.
This is just our standard annual increase.
All right, good deal. Any questions? Those in favor?
Aye.
Those opposed? Motion passes. Thank you very much. Director Wiley, anything else to add?
I just want to highlight one thing from the report before you, and that is our expense numbers were elevated simply through an accounting practice. Our expenses were not up in the month of September, but there were adjustments actually going back to 24 and 2022 that just had to be posted, and so they were posted in the month of September to the tune of roughly $214,000. So if you look at the expense number for the month and subtract $214,000, That's where our actual operating numbers were for that month.
Gotcha. Okay. Well, I know that the nursing home and you and the staff has dealt with some significant unexpected challenges in the last couple of months. So thank you for weathering the storm and keeping up the good services that are all offered through the nursing home. Any other questions, comments for Director Wiley? All right, thank you very much. Moving on to 5C, we have Ms. Hughes from the Jail Superintendent and Ms. Sturm from Advanced Correctional Healthcare. We have one item for action, item 5C1, request approval of an agreement between the County of McLean and Eric Abreu, DDS. May I have a motion? Motion by Hanson, second by Farley. Any questions, comments?
Good afternoon. This is our annual renewal for the contract with the dentist, Dr. Abreu. I also have a proposal for a 3% pay increase. Dr. Abreu has not had a salary increase, I learned, since 2018.
Okay, questions for that? Those in favor?
Aye.
Those opposed? Motion passes. Thank you very much. Anything else to add?
No, Ms. Strum did the report. If you have any questions regarding that, we'd be happy to answer them.
Excellent. Thank you very much, Ms. Strum. Anything to add?
Nope, I have nothing to add. Thank you.
All right, thanks very much. Any questions from members of the committee? Okay, thank you very much. Moving on to item 5D, Jason Tabb, Juvenile Detention Superintendent. No items for action today. Mr. Tabb, anything to share?
Yes, you'll see a decrease in the number of contacts in our medical. Right now, we are without a nurse. We have a part-time nurse right now who's filling in the gaps, making sure that we're staying within the standards set by the state. But the overall numbers are going to decrease significantly over the next couple of months until we get a new nurse to replace them. The doctor is still coming out weekly, and he will be taking on more of the day-to-day as needed for things that the kids need.
Okay. Do you feel like we're adequately able to cover any medical services, things like that?
Yeah, current population, we're good right now.
Excellent. All right, thank you very much. Any questions, members of the committee? All right, thank you very much, Mr. Tabb. Lastly, 5E, Cassie Taylor, County Administrator. No items for action today. Anything to add?
Chair Byrne, I would like to just mention that our Behavioral Health Forum that is sponsored by McLean County and many other sponsors locally is going to be held this Thursday at ISU. It is, I believe, the largest registration that they've had in a few years. So the turnout is exceptional this year, so hope to see you all there.
Excellent, excellent. Yeah, that has always been a fabulous resource, very well attended, and a ton of good information. So if you have not been out to it and can swing by for a while, it is definitely worth checking out. It is definitely a tremendous community resource. So thank you to all those partners who work on that. Anything else from members of the committee? Would like to welcome and thank Alderperson Scott from the city of Bloomington to come by. And other than that, thank you all very much. Our next meeting date will be Tuesday, December 22nd at 4:00 p.m. and we are adjourned.